they tell you in the group if we're cutting this short to get back on schedule, or did they say?
Good afternoon, everyone. So you're very welcome. I hope everyone can hear me. So right now, I'm the moderator, and I want to introduce Anne Mine. So following her own diagnosis and extensive treatment in 89 to 90, Anne realized the importance of sharing and of evidence-based knowledge, that she began her active advocacy, including a breast cancer support group. ACS Reached Recovery, and Susan G. Coleman, Houston volunteer and board member. Since her retirement, she has become more involved with patient advocacy research programs. She has been a patient advocate for the UT MD Anderson Breast Cancer Spore Program. Currently, she represents MD Anderson as the patient advocate for the Translational Breast Cancer Research Coalition, where she was selected as co-chair of the Patient Advocate Working Group, and participates in several patient advocate roles at the Houston Methodist Research Institute, including serving as a patient advocate for Department of Defense Innovator Award, Department of Defense Breakthrough Level 4, the Data Safety Monitoring Board, and Physical Science Oncology Network, and chairs the Coleman Advocates in Science Steering Committee. Thus, as a Coleman Scholar, in July, she began a 3-year term as a patient advocate on NCI's Breast Oncology Local Disease Task Force, and Anne enjoys working with various scientists as a patient advocate on many research projects within the Texas Medical Center. My gosh, we're blessed to have you today. Welcome.
Hello, and that is not the role I'm playing here today. I'm actually playing the role of a caregiver. My husband of 49 plus years was diagnosed with metastatic squamous cell cancer in 2011, and we had the cancer journey. He passed away in December of 2017. So today I'm speaking to you on a much more personal level as my role as a caregiver. Don't need that. No one can be a caregiver every day, 24 hours a day, for months and years. No one has that kind of stamina. Probably the most important thing to try to remember to do is to reduce stress by preventing depression, and that can develop over time. It's support that you can hopefully get from family members and friends in caring for the patient, in this case, my husband. Try to remember to fit some exercise in, have a healthy diet, some spiritual support, and whatever is comfortable for you, whether it's praying, journaling, meditation, something to help support you spiritually. Recreational time, when you can enjoy friends socially, and get help from trained mental health professionals. I can't say I did all of those things, but they are certainly recommended. Try to plan things that you can enjoy, or that you can enjoy with your loved one that you are caregiving for. But if you can fit in a way to take time, my husband was definitely on a roller coaster, and this may be the case with many of you. Sometimes the side effects were much less. If it was post-op, they were going to be pretty intense for a while. But as I said, he was diagnosed in 2011, lived to 2017, and especially in the earlier years, it was, unless it was right after a surgery, and he certainly had many, he called it whack-a-mole, that we would get it taken care of in one spot, but he was de novo. I mean, it had spread when it was diagnosed. So they'd get at one place and it'd go someplace else and then go someplace else and someplace else. I mean, I lost count of how many different places. So unless he was in one of those places, he could fend pretty well for himself. So I was lucky as a caregiver because it wasn't constant year after year. It had its roller coaster effect. He continued to work even though he retired in 2011 officially. He was a researcher at MD Anderson for 49 plus years. And so in between, he would host his lab, have his lab. Even though he had retired, he was still working, quote, 20%, which was kind of a joke. But even when he had a feeding tube from the radiation and everything else that had gone on with him, he would feed himself and call a meeting of his lab. So he could fend for himself on and off. Not that I wasn't doing this at home, but he could do it himself at times until after a couple of really hairy surgeries and many radiation go rounds. And so it did get much more intense as time went on. But try to work in, and I did, especially in the times when it wasn't as intense. Have lunch with a friend. Give yourself some sort of sense of accomplishment. Like, okay, this weekend I'm going to clean the closet. It's just something that you can feel like, I've done something. And some way to, my husband, Ray, actually wanted to, he got so, the only kind of movies he wanted to see were funny ones. He didn't want to dwell, and I can remember that myself when I was going through cancer treatment. I never saw movies that dealt with cancer. I couldn't do it. I didn't want to do it. And there's some very famous movies I have never seen because I just couldn't deal with it. And set aside some time with your person that you're caregiving for to talk without talking about the illness. Whoops, went the wrong way. Okay, let's see if I can, I'm going the wrong way again. Okay, do reach out for others for help. And now it's big up there, okay. Try not to feel guilty. I can remember times when I did take a break and do something and then come back, whether it was even going to the store and come back and there was a slight trauma that would have been good if I had been there. But you gotta be good to yourself. You've got to, and I can't say I always was. And there was that quote this morning about that very same thing. Give yourself a break. I mean, maybe a physical break or maybe a break just away from any guilt. And try not to feel inadequate or unable to do enough for your loved one. Your loved one knows you're there and that you're doing the best you can. And don't feel selfish for asking for help. Or I might even ask if it were sometime when he was in much more need of care. I'm fortunate enough to have both of my grown children here and their spouses, and to ask them or ask a dear friend to come. I can remember my husband actually getting mad at me one time when I called or emailed one of his good friends to just come over and keep him company because I didn't want him to be by himself so that I could run a bunch of errands that I needed to run. And he finally found out in conversation that I had done that, and he was not happy with me. But just the same, I don't regret having done that. It was okay. One of the things that I can't say we ended up being that great on was You need to communicate honestly, both parties. I would always I would go with him to the doctor's appointments and I would listen to what the doctors said, about physical therapy or whatever it was. And so I would encourage him. Sometimes I might say nag him about doing whatever it was. And he wouldn't say, I just can't do it. And he ended up, I would be at MD Anderson and I'd drop him off at physical therapy and assuming it would be the same timeline and then go back and he was sitting in the hall and I went, what are you doing? He said, I just couldn't do it today. Well, why didn't you, he's got a cell phone, I've got a cell phone. Why didn't you text me to come sooner? And he never let me know as bad as it was. And I regret not having pressed him on it. And it was, he was telling everyone, I should have taken all the clues. But in retrospect, I can say that. But I didn't realize it at the time. There are resources for caregivers, actually quite a few. You'll find from Karen, there are a lot more than I have listed. But if you contact American Cancer Society, there's a caregiver resource guide. AARP has 5 steps to navigate the cancer caregiving journey. CanCare has resources. Living Strong, comprehensive guide for caregivers. Whoa, well, it looks good on here, but my screen looks terrible. Okay, now I'm going to introduce you to Karen Davin, who is very accomplished, certainly in her own right. She is a nurse navigator with MD Anderson. She guides, she does exactly what Abby Kaler was doing. So if you heard all the roles that Abby Kaler just said next door, she does all that too. And she does it for lots of different patients, not necessarily one specific kind. So she finds all the resources that the patients need, including answering good questions and giving them guidance to asking for good questions for them to ask their doctors. She helps them communicate with their teams and assist in making informed treatment decisions. She's a 25-year oncology certified nurse. She graduated from nursing school in 1991 with a Bachelor's of Science degree from Texas Women's University. Then she got her master's degree of public health from Creighton Medical School and a postgraduate certification in healthcare ethics from the Center for Health Policy and Ethics at Creighton University, which I know is in Omaha, Nebraska. I'll turn it to you.
Thank you so much. Can everybody hear me okay? Welcome. Well, we're going to have like an interactive session today. So hopefully you can see my slide. So we're going to be focusing on the resources, communication, handling emotions, and some additional resources. And if you'd like a list of these resources, just send me an email and I'd be more than happy to send that along to you. So in terms of who is the caregiver? So we have lots of different caregivers. We have unpaid or informal caregivers. We also have formal caregivers. And there's one particular slide that I had here that is just not coming up right now. Let me see here.
It may come up on the screen and you don't see it on that screen. That happened to me.
No, it's missing. It's okay. That's all right. That's all right. I'm just going to go back and just let you know that there was actually a quote here from the CDC. So this was actually from the 2009 data from the state-based surveillance system. And in 2009, they actually estimated that the value for unpaid and informal caregiving was estimated as being $450 million. Did you hear that right? $450 million. That's a lot of work. So it was interesting in the same in this same data, it actually showed that over half of those caregivers indicated that there was a decline in their own health. That was over 53%. I've actually come across caregivers who have been diagnosed with AFib. I've had patients who've missed their screening mammogram and now are presented with, locally advanced breast cancer. I've had patients who've missed their screening colonoscopy only to find that they have more extensive colon cancer. 1 in 4 of these caregivers, that's 27%, they reported lost wages, additional medical expenses, and that they were having moderate to high financial hardship. So, of course, needless to say, all of this showed increased anxiety, depression. There was worse self-reported physical health, a compromised immune function, and an increased risk of early death. So there are positive and fulfilling aspects of healthcare, being a caregiver. This feeling of being useful, learning about the meaning of life, joyous memories, passion, purpose, and establishing extended friends and networks. So this is actually the quote I'm going to read from CDC. While some aspects of caregiving may be rewarding, caregivers can also be an increased risk for negative health consequences. These may include stress, depression, difficulty maintaining a healthy lifestyle, and staying up to date on recommended clinical preventative services. So we just need to be mindful of that for our caregivers. So as you see, George Bernard Shaw, an Irishman, said the greatest problem in communication is the illusion that it has been accomplished. Well, we are human. There can be lapses in communication. And I encourage patients, instead of sometimes wasting our energy, or even in terms of our caregivers, wasting important energy on maybe trying to struggle to prove that we did actually communicate, sometimes it's easier just to say, I'm sorry, and move on. Listening is at the heart of communication. So we need to assess, what are our barriers to listening? So if we look at our personal needs at the time, are we hungry? Are we fatigued? In terms of our moods, are we feeling down, angry, sad? In terms of our attitudes, do we notice that we are changing our attitude to our loved one? Sometimes I hear caregivers express this when they actually see sometimes their loved one deteriorate. This can be hard because this was someone that was right by their side. Is it a bad time of the day? For example, of having a discussion with someone, maybe my loved one has just exerted a lot of energy, they're exhausted, they're breathless. Maybe this is not a good time to bring up things. And in terms of choosing the right environment, location to have a discussion, make sure this is in a good environment where someone can actually hear you well, can see you well. There's not going to be constant phone interruptions, background noise. So what are these strategies that we can do from listening from the heart? Prepare yourself. So let's say, talking about my dad, I recently lost my dad. So things were like, what if dad refuses to give up his keys? Be thinking, prepare yourself. Prepare people for an exchange. I want to hear your point of view on this. And then develop that trust and confidentiality. Assure the person, I won't feel mad about what you say. I want to hear from you. And I'm going to keep this confidential. I'm going to keep this discussion between the two of us. And that's important, particularly if there's a lot of siblings involved. Make sure, again, the best time of day. Make sure, as the caregiver, I'm not tired, hungry, and cranky. And make sure that the care recipient is not tired, hungry, and cranky. And most importantly, choose the best environment. Don't catch somebody off guard, like saying it in the car or something like that, or saying it on the way to an appointment where somebody is just may not necessarily be prepared for this. Did I do that right? Okay. So, expressing yourself effectively. There are different styles of communication, and we're just going to go over those different styles. And each have very useful tools to effectively communicate. We talk about the I statements. Make sure that we use our I statements appropriately. I am worried, as opposed to, I know how you feel. Really? And speak directly to the person. Respect their rights. Respect their feelings. For example, you didn't call back, as opposed to, I was hoping to hear from you. There's a difference. I hope you hear that difference. In terms of, there's also the assertive style. Now be mindful, being assertive is not being aggressive. There is a difference, and we will cover that a little bit later. And then there's the aikido, which is a gentle, supportive way. So in terms of for the assertive style, as you can read here, I'm going to give you an example. Basically, we're talking about being direct, being honest. So we have, in terms of like steps for doing that, first of all, we describe the situation, we express our concerns, we specify, we give consequences. I'm going to give you an example. Anne, I got a call from the doctor's office today. Okay, I've described the situation. I'm going to express. They have rescheduled the appointment. I'm concerned that Dad may not be able to make the appointment. And that's where we have expressed, and also in terms of now going on to specify. I need someone to take Dad to this appointment. It's specified, that's our need. And finally, consequence. And I can take Dad to his next appointment if I can count on you to take him to this appointment. It's simple, it's straightforward, it's direct. We describe, we express, we specify, we give a consequence. Now, it's not aggressive. Aggressive is when someone is actually going to be putting you down, is going to be insulting you, is sarcastic. That is aggressive. So there is a difference. Now, the Aikido style. Now, I don't need to use this for Anne, but let's just say there was a grizzly bear that was actually sitting there in the chair. In terms of the Aikido style, is actually a great way of communication, of actually reducing anger. So this is where we would actually align ourselves with the individual. When you hear that anger, okay, how would I feel in that situation? Now, granted, you're saying this to yourself. And what kind of support would I need right now? What would be helpful for me to hear? And then you agree on common concerns. So if your caregiver is expressing issues, focus on the common concern. Then if they start going off on tangents, redirect them, bring them back to the common concern. Let's say, we were at the physician's office. It was, I felt I wasn't being heard, and then going off on different tangents. Bring them back to that common concern. And then resolve the issue by being there in the middle ground, because then you can actually move forward. So keep in mind, in the terms of the use of the I statements, these are one of the most powerful, effective methods of communication. I am worried about you. And be aware of some of those hidden you statements because you're irritating. Let's leave that out because that just gets, people rallied. And as we have mentioned, in terms of assertive communication, you are trying to be direct to communicate information. You're not trying to win. This is not a debate. Being assertive is actually giving clear, direct communication. I'd like to bring up something that Anne had said earlier, which I thought was absolutely wonderful. Sometimes in our past, sometimes in our training, even growing up, we were told some things. Now we need to eliminate those falsehoods. Sometimes we were told that asking for help is selfish. No, it's not. Sometimes we were told that standing up for yourself is rude. No, it's not. And, one thing I heard as a child was, children are better seen and not heard. I'm sure a couple of you were told that too. So think about the assertive communication. And then we're just going to look at when is the best time to use your assertive communication and your Aikido information. So again, using your I statements for your assertive, you apply these best tools to express yourself, which we've already gone over. But beware of limitations to this, okay? So it's actually good for advocating for another. For example, you go along to the physician's office, you want to be very clear. It's good to advocate for your loved one. Or in terms of making difficult decisions. Sometimes I know with my loved one too, when we were coming to a point of making difficult decisions about what do you want to do in your future. This is where a decision is going to be made. I'm just asking for your input into that decision. It's clear. And then in terms of sometimes if there's difficult styles of communication, which we'll go to in a minute, it's good to redirect somebody. Then the Aikido style, as we mentioned beforehand, this is really good of actually disarming somebody in terms of for anger. It's good to be able to redirect somebody, and then just to also help in terms of balance the emotions and to deal with the issue on hand. So I've got a quiz because I just want to make sure that you paid attention. All right. So asking for help. Which one do I use, the assertive or the Aikido? Okay. So asking for help, because again, we're going to be direct. That's a big clue. If I'm going to be direct and clear, there you go. Good job. Now, if I want to reduce anger, because remember, I want to align with that person, what should I use? Aikido. Perfect. And then in terms of, you see the difference between this? You shouldn't be living alone, as opposed to, I'm concerned about you living alone. There's a difference. So now we're going to talk about challenging in difficult situations. So in terms of we need to be mindful of setting limits. So when we look at, for example, communicating your limits, for example, what is the best outcome for this situation? What would be the worst outcome of this situation that I'm dealing with right now? And could I handle that? Now, look at that versus having no limits. Feelings of resentment, caregiver burnout, concern by your family for your health, and health problems related to stress, fatigue, and even risk of death. So ask for help. Okay, I've got another activity. This is a fun activity. All right, we're all sitting at a dinner table, and there's some salt in the middle of the table. Now, hands up. How many of you people believe people should automatically pass the salt to you without you asking for it? I want to see. Hands up, please. No hands up. So, would you blame the people around the table for not passing the salt to you when you needed it? Hands up? No hands up. So, would you plead? Would you beg? Would you whine? Would you give a hint about passing the salt? Hands up? No. So now let's come back to ask for help. So if you need help, ask for help. It's a caregiver's responsibility to ask for help. Because if you don't ask for help, you're going to get burnt out, you're going to get fatigued, you're going to get resentful, and this is going to impact your caregiving. So you have a responsibility to ask for help. And have a list of things handy. Have a list of things where you need help. So is that when somebody offers help, yes, could you, bring the laundry, or bring the laundry for me, or, down to the dry cleaners, or could you walk the dog, or, could you pick up my children from school, or something. Have a list ready. You don't mind delegating that. Expressing and responding to criticism. I'm going to look at the two focuses here. First of all, expressing criticism. Sometimes if a caregiver is looking at the care recipient, and they want to say something, just be mindful of the right time. Make sure you're not hungry. Make sure that you're not in a bad mood. Make sure that there's not other issues going on, because this will come out in your critique. And be mindful in terms of, oftentimes it's not necessarily the statement or the criticism that's hurtful. It's the delivery of the criticism. Usually that's hurtful. And then be mindful in terms of, as the caregiver, if the care recipient is critical, make sure to address this promptly. Because if you don't address it, it's going to continue. Again, be mindful about how you address it. And in terms of, and then resist sometimes the having an opinion of why the person offers, this criticism, or mind reading, or judging the situation, or making comparisons, particularly if you're looking after a number of people. So in terms of constructive criticism, offer constructive criticism. I'd like to hear from you the way you would actually prefer this to be done. That's helpful. In other words, I want to hear from you. So there's a way that we can actually say things. Let's say for my kids, grandpa, you know, um, I'm worried about grandpa in the bathroom. Now my father didn't do this. I'm just using this as an example. He throws down the towels after his shower and the floor is wet. So I've already described the situation. And I have already expressed my concern. Now, in terms of specify, I would like to have those towels put into the laundry. And then in terms of my consequence, I'm fearful when I go into the bathroom, that I'm going to slip or I'm going to fall on the floor. And also in communication too, for criticism, sometimes to save face for people, which is good. You know, it's easy to see that that was a mistake. I could see how you would have thought that. That's a good way to actually preserve your relationship and your friendship. So if you're being criticized, you're now the caregiver, you're being criticized. Think about this. You know, is it right? Is there some merit in that? Is there something that I am doing, you know, or behaving that I'm not aware of? So just be mindful of that and apologize. Just say, yes, okay, I recognize this now, I'm sorry. Now remember, apology does not contain the word if. So if you say, well, if I was wrong, I am sorry, that's not really an apology. As I tell, even in terms of a lot of my colleagues in work, the Q-tip principle. Have any of you heard the Q-tip principle? Quit taking it personal. Yes, the Q-tip principle. So that's where, for example, if somebody is irritated or annoyed, just find out why. And again, just to find out, you know, it would be helpful for me to know how you would actually do this. Sometimes if things are really getting difficult, excuse yourself from the situation, excuse yourself from the room. Anger in the same way. If this comes up, expressing or responding to anger, really don't encourage you to express, you know, anger certainly with your loved one. But, you know, speak in a normal tone if somebody is angry at you. Remember, use your I statements. That's really important because that gives you that empowerment in that conversation so that you're not going to be unnecessarily critical. And then use humor. Sometimes humor can be a great escape, particularly if you're in a tense situation. And sometimes, you know, you can change the subject. So communicating with your doctor. And I think Anne's gave some great, you know, examples here, communicating with your doctor. I know, for example, for my patients, even Pfizer Oncology out here, they have a wonderful app on the phone. This is Living with Cancer. If you don't already have your app, I suggest go get it. It's very easy. It's a free app. But it's a place where you can actually jot down all your questions when they come to you. And I tell my patients and caregivers, when you get a question, you take that time to write it down because you may not remember it the night before you go in to see the doctor. And it obviously was an important question. So act on it and write it down there and then. And in terms of if it's going to be, you have a number of questions or you're trying to make decisions, call the office ahead of time. Prepare them so that you're not going to be catching your physician or your team off guard and they're not prepared to give you an answer. Call ahead, let them know. Take somebody with you, somebody who can also hear what's going on. Sometimes when we're actually there, some of our caregivers, some of our patients who are actually going through this, they might actually hear maybe 1 in 5 sentences. The other is a blur. I know where I've actually gone along to office visits with patients, and they'll say, I heard this. Well, actually, your physician said this, this, and this. And that's really helpful and reassuring. And then build that relationship with the office. When you go in, get to know the team, get to know the office staff, get to know the receptionist. Then they welcome you and they get to know you. And it makes things a little bit easier. And don't be afraid to ask for a second opinion if you want a second opinion. And that's okay to do so. And don't be afraid to ask in terms of about tests. Why are we doing this test? What is the result of this test? Why are we doing, treatment plans? Or what are the different types of treatment? And then we also look at, for example, getting information, um, to make sure that that's not going to be problematic. Again, some of those strategies that I mentioned earlier, working with the staff to make sure that your issue is resolved. There's other challenging situations, for example, communicating with the hearing impaired, the visually impaired, the memory impaired, and of course the abusive care receiver. Just be mindful in terms of for hearing impaired individuals. Don't sneak up on anybody. Make sure that they can actually see you. Make sure that they can see your whole face. Don't put anything in front of your face so it's actually preventing people from lip reading or seeing all your facial expressions or seeing gestures. Be mindful of that. Also make sure, as I mentioned beforehand, that there's good light. And then in terms of for the visually impaired, again, announce your presence. And make sure that the light is adequate and speak normal and direct. And that's the same thing for individuals who are hearing impaired. Please don't shout. When you shout, you actually change the way your lips move. So people have difficulty in actually lip reading when you shout. And then in terms of also for the visually impaired, when it's appropriate, touch. Just appropriate touch just to guide somebody or to redirect somebody. And there's lots of those low vision aids, particularly for people who have like macular degeneration, that you can use. For the memory impaired, for some people, just find out what's best. Do pictures work best? Does in terms of direction or gestures work best? For example, for somebody who may be having difficulty with memory, on the chair, pat the chair. Do you want to sit down here? Because you're kind of directing somebody to, to what they need to do. And then in terms of for the abusive care recipient, sometimes this can happen, but does that mean that you have to give up your own personal rights? No, it doesn't. But it's a matter of how you actually handle that. Be mindful, as we said beforehand, it still needs to be addressed. If you do not address a situation of abuse, it will continue. It's not going to get better. But it's a matter of how you actually address it. So, in terms, that's where you're going to, again, be direct. You're going to tell somebody, for example, I feel insulted when you're making jokes at my expense. And if it comes back at, oh, well, maybe get some thicker skin. Well, it offends me. And I want you to know, I want this to stop. And, it won't be a joke when I'm going to call you out on it next time. So set your boundaries, set your limits. Now, this can actually be used for a caregiver or care recipient because people can fall into different categories in terms of personalities. Okay. Is this going up here? I'm sorry. Okay. Obviously, there's so just be mindful in terms of the mixed feelings that we may have. For example, denial will actually get better in terms of as we as we mention as we tell our story, more sorry, this skipped a slide, so my apologies. So as we reiterate our story in terms of our denial decreases, it's normal to have, fear and anxiety, fearful of what's happening right now, fearful of where we're going in the future. In terms of our anger, and again, just to ask, why are we angry? Where are we at right now? What's going on in our own lives? Resentment, being mindful of that. We've already addressed that in terms of being mindful in terms of that if we're not going to speak up, if we're not going to reach out or be direct to our care recipient, there's times where we can actually develop resentment. There's also resentment in other issues, and that's as resentment for our dreams. For example, with our care recipient, we had dreams, and now this has actually happened. Our dreams have actually changed. And then in terms of for guilt, was this something I should have actually, maybe I could have actually done something better. Maybe I could have handled the situation better. And in terms of depression, hopelessness, some suicidal thoughts or ideation, and we need to see somebody for that if we're having those issues going on. Be mindful in terms of grief. Grief is cyclical. So just why we even talk here about our mixed feelings, when we have grief, we go into feel any of these emotions at any time. Be mindful in your situation that you might feel happy. Somebody might just say something to you, and all of a sudden you can be plunged into a depression, or you can be plunged into a fearful situation again, or into a denial. And that is normal in terms of that cyclical aspect of grief. Sometimes it's helpful to know that's what happens. Be mindful too of grieving your losses, grieving the losses of your dreams, the things that you were going to do maybe together as a couple, as a family. And then also be mindful of changing our negative self-talk to positive self-talk. Because what we say in terms of our thoughts, what we express, this will actually guide our emotions. So if we're actually telling ourselves we are fearful, you're going to feel fearful. I'm really angry at that situation. We're going to get more angry, or I'm very resentful. You'll start noticing that you can be getting resentful. So just be mindful of that in terms of for our self-talk, and think of positive things that actually bring you joy, things that bring you passion, things that bring you purpose. Try and bring that into your mind. Now, this was not one of my slides, but I just want to go over this. It just talks about sometimes the different personalities. And that is being mindful of that. So some of our caregivers, we have to, caregivers and also care recipients, just be mindful of the personality. So for example, you have the passive personality, somebody who will want peace at any price. So apologetic, self-defeating, always, seeking approval. Basically, this is my fault, in terms of what's actually going on, and I'm responsible for your happiness. So being mindful when you're working with somebody like that, or caring for somebody like that, in terms of how we actually communicate. Recognize how we're coming across. And just maybe at that time use the assertive method with gentleness. Please tell me more. I didn't realize how I was actually coming across. There's also the personality that the aggressive, or I call the pit bull, personality. This is the person who's angry, temper tantrums, critical, ridicules you, discourages you, makes jokes, undermines you. At that particular stage, a good strategy is the Aikido style. Again, trying to disarm the person, look for the common ground. And again, that's where using those I statements of how you feel is actually helpful so that this does not escalate. And then in terms of just be mindful, in summary, we were talking about our express your feelings. It's okay to express your feelings. Um, Talk to understanding people when you need that time if you're in that struggle. Give yourself permission to cry and get the support that you need, even if that means going to a support group, or as Anne had actually said, where she had a friend called a friend to come in and stay with her husband so she could have that time to get out and look after herself. And finally, to all the caregivers in this room, you're all superheroes. Be mindful of that. And one acronym that I always had for hope, and that was healing, onward looking, perseverance, and endurance. And I'd like to thank you all very much. And let's open this up to discussion, questions, and things that helped you. This is like a wonderful support group here. Maybe there were things that kind of helped you with working with your loved one, working with a care recipient, and maybe you could share that with other people. These are our caregiver resources. I'd be more than happy to send that along to you if anybody needs that. Um,
I don't need a microphone after this. I just want to ask you a question. I'm not even sure how to ask the question, but so my wife has been diagnosed obviously with metastatic breast cancer. And so the life expectancy is the average is 5 years. So I mean, it could be 1 year, it could be 10 years. We don't know. Of course, no one knows.
Right.
And is there a, is there a way that's better or a time that's better to deal with financial matters, like asking her about a will? I mean, how do you deal with that?
Well, for my husband and I can tell you that we had a current will. We hadn't done one in years, and we did have a current year. The bad thing was we never got to those questions that we should have gotten to. I had not a clue. He paid all the bills. I paid like department store bill. I didn't even know if we had a mortgage, much less what to do with it. Um, so, and it occurred to me when he was in the hospital, I didn't realize this was it. I mean, there was some lack
actually establishing that trust. Okay, this is where we're at. Secondly, in terms of decision making really for all of us. We shouldn't wait until we actually have a chronic disease or cancer. We should be making these decisions early on in our lives when we're actually healthy, where we can make informed decisions and informed choices. I would actually encourage people to do this earlier on, in our diagnosis, as opposed to waiting until later on when people are fatigued, people are exhausted, they're going to be having difficulty making good judgment. And they're just at that particular point probably just pushing it off and pushing it off. So I think a good thing is to say, I want to hear from you. What are your thoughts about this? I want to be able to respect you and what your wishes are. What are your wishes on this? Because I want to make sure that I'm following your wishes. Now, all of a sudden, you've used all those I statements, and you've basically have said, this is really about you. In other words, I'm focusing on you as opposed to I'm focusing on all the bills that I have to pay, and we may actually lose our house and our car.
Right.
So that changes things. And then once you've established that communication, now you can focus on your topic and say, we're looking at things and strategies. And by the way, if you need some help with foundations, there are a lot of foundations out there. I tell all my patients, all my caregivers, apply to every single foundation, not one or two, every single one of them. And usually you can ask a nurse navigator or you can ask the social worker, for some guidance if you need some guidance. But most of these foundations are very user friendly. You just get on, you click, and you go through. And, in terms of for the Komen Foundation, I have actually reached out, in terms of to Pearl for the Komen Foundation, and that is for the breast cancer helpline. They have been phenomenal. I've been able to get patients, onto copay, assistance programs and other programs. Does that help you?
Sure, sure.
It's down to the communication. It's a touchy thing that you don't want to say. I mean, when I look back, and I have always thought of myself as a good communicator, but clearly we weren't communicating on certain things. Yeah. And the will wasn't one, but certainly the bills and status and income tax. Oh my God, I've never done the income tax,
Right.
things
then-
that are pretty important.
And then also select a time, coming back to
Yeah.
timing, so that you're going to prepare your loved one. I want to hear your thoughts about this, that this is something that's important to me to know. So let's pick a time. So at least you're preparing the person. You're not catching them off guard, because now we know what the topic is.
I just wanted to add, just because the person that is sick, that person may outlive the caregiver.
Mhm.
So one of the things my parents did, the wills, information about insurances, any information you needed to know was in a safety deposit box. So at their death, all you had to do was go to the safety deposit box. Every piece of paper, every bit of information you needed was in the safety deposit box about bills, like I say, insurances, will, burial policies, where it was, where the plot is, any and everything you need to know, it was there. So I suggest to even the caregivers, get that kind of information somewhere and tell somebody where it is, because you could not outlive the person that you're taking care of.
Thank you. And you brought up a very good point, and that is passing that information on, but also keeping it updated. I mean, I've actually come across individuals where the executor of the will ended up being a person who was 92 who had Alzheimer's. This was a person who could not be an executor. but they had never updated the will. So just be mindful of that too.
I can add a funny thing with that. With my parents, um, when my father died, and by the way, my mother was the caregiver. She ended up, he had a stroke and was paralyzed on one side. So she had to dress him every day and all these kinds of things. And we tried to do some things to help, like get him shirts that snapped that he could do with one hand, elastic waist pants he could pull up, those kinds of things. But he had brace that he had to put on. She ended up with a femoral hernia from doing it all herself. So take care of yourself, folks. And but when we went to the attorney, she said, well, we have a will. Their will was made during World War II. So obviously nobody here is going to have that issue, but you know, Karen is spot on to keep it up. Now I have to say, I can regret not having done some communication with my husband, but my kids know everything, absolutely everything. And the one thing I haven't done yet, I mean, I've changed the will, they know where it is. The one thing I have not done yet is getting them to be have signatures at the banks so that they can access money for any debts or anything I might have. That's one other thing. And we do have a safety deposit box with the will on it.
Mhm.
So any bank accounts, anything with another individual's name on it, your name needs to be added. Otherwise, power of attorney ceases that debt. You can't get into banks, you can't get into anything unless your name is on it. So, and I'm saying your name, a responsible person.
Yes, yes.
Name needs to be on there besides, just one person. Because you can't get into. If you're, yeah, you know, like, when I was younger, it was my parents on there. When they both died, it was my sister. I'm on hers. So that bills can get paid if I get incapacitated. If I die, they can still go to the bank and be able to access funds to take care of it.
And you know, you brought up a wonderful way of communicating that right there, going back to your discussion. How do we have this discussion? How do we bring this up? Because you brought up practical things. We need to make sure that our bills are paid. We need to make sure that our children are taken care of. We need to make sure that these things are actually done. And that's where it's very appropriate to say, you know, at this particular point, if I can get a release from you that I have access to your account. Maybe some people may not necessarily not at that point immediately to put you on as a co-signer or as a joint owner of the account, but at least to say, I need to be able to have access to your accounts, or or your credit cards, or paying off your credit card bills, or I need to know where you put everything or where you file things. Particularly, for example, if you happen to have one party who pays all the bills and nobody else knows where anything is, that's where it's important to actually go through that and to specify where things are.
I think there's something, it's a book that, I think it's called A Living Legacy, and it tells you step by step. You just write everything in the book, you make copies of everything, and then you take that and you put it in the safety deposit box. And maybe a good way to bring it up would say, this question came up and we were all talking about it. It's something that we need to think about. Because you're right. I mean,
yeah.
I could walk out here and be run over by a bus. You
And-
never know.
And you could say, we were just talking about this in the Caregiver
Right.
Breakout, and why don't we talk about it? Yeah. Yeah. So the one thing I didn't bring up that you have brought up a lot of things is credit cards. And as it turned out, our main credit card that we used all the time for everything and I was authorized user, and it had a really high limit on it. I had fraud on it. And when I called about the fraud, they found out my husband was deceased. They said, we need to talk to the owner of the card. And I said, well, she said, you are an authorized user. Raymond was the owner. So you need to be co-owners, and that needs to be clarified, because then they canceled that credit card and sent it to a collection agency. We had always paid it off every single month. And so I probably had ended up paying for the fraud. I never could find out whether the fraud was covered or not. And it was $700 of fraud. So I probably paid an extra $700. So my advice is be co-owners of a credit card.
Well,
We're over our
yes.
time.
So first of all, I want to say thank you all for coming. I hope this information was helpful to you. If you want me to send any of that information to you, there's my email address, and I'd be more than happy to send those links on to you. Okay? Thank you again.